Please welcome to the stage, Marielle Concepcion, MD, owner and CEO, Big Trees MD.
Hi guys, good morning. I'm so glad to see you on day 2 of Hint Summit. Now, I just wanted to make a quick announcement. If you are walking around, please gather in because you're not going to want to miss this next speaker. And when you're sitting down, please make sure to have your cell phones out. You'll find out why later. Now, Hint Summit is the DPC Summit about innovation. And innovation means having the courage to do something different. And it only takes one person to think differently and to dream differently. And when that one person thinks and dreams differently and shares those thoughts and those dreams with another person, that leads to inspiration. And when that inspiration is then shared with another and another and another, that is how change is made. And we see that change every day when we look at the change that the US healthcare system has because of direct primary care. And it is through continuing to inspire each other and our communities that we will continue to grow DPC. Now, I want to welcome to the stage someone who had the courage to think and dream differently, and who has not only thought and dreamed differently, but who has taken action on those thoughts and on those dreams, and has empowered us to be able to live our dreams. Please allow me to welcome to the stage the one, the only, the epic Holdsworth.
So many old friends, but also so many new and interesting people who all share a common vision of transforming the healthcare system for the better. And I just wanted to invite the folks that are sitting around there, if there's spare seats up here, I invite people to come in here because we're going to have a little bit of an audio-visual experience, and it's going to be way better in here than it is over there. So I'd love it if you fill up the seats here, and also I like having a full audience with me. My name's Zach Holdsworth. I'm the co-founder and CEO of Hint Health. And my talk today, the first part of my talk today, is about darkness and light. And I'm going to be taking you on a little bit of a journey with me, kind of through darkness and light. And I wanted to kind of share some of my views on how I believe that we can transform the US healthcare system. I'm also going to be bringing some key team members up with me, who are going to kind of help me talk through a few key announcements we've got, and also some of our plans going forward, which we're really excited about. So into the darkness we go. So as we know in our society today, there's increasing kind of divide in our political systems, right? We're increasingly partisan and not able to make decisions that make sense for everyone. We are increasingly at least in part, and we talked about some of this yesterday, but at least in part, not able to do that because of exponential technologies and social tech and things that are really starting to hijack our attention. And this is a crisis in my mind. We're also seemingly not able to address catastrophic risks like climate change, for example, or the proliferation of nukes, or the potential AI risks that we face, which again, we spent some time talking about. We've gone from, through a pandemic, which I would say, aside from perhaps maybe vaccine development and the courageous work of healthcare workers, I think we really kind of failed the test somewhat, right? It was a relatively mild pandemic compared to what it could have been. And I think this is partially as a result of our ability to communicate and make sensible decisions as a society. We've gone from a pandemic into a war, which is with a guy with nukes, and then coming out of that war, not coming out of it, which is at least in part responsible for the potential food crisis, which could put hundreds of millions of people at risk of going to starvation. And it seems that we're also entering into a recession. So a lot of darkness. One of the things that I think is a key risk to society is that the wealth gap is continuing to divide. So every single civilization in humanity that has had this happen has collapsed, right? And so this is a fundamental problem. And we're still wasting $1 trillion per year in the US healthcare system, which in my mind is truly a problem, especially for a country that is partially responsible for solving a lot of these global catastrophic risks, and potentially you could argue should be leading the charge there. The other thing to note is that we're not getting a good deal for that spend, right? We're spending close to 20% of our GDP on healthcare, and compared to a bunch of other OECD countries, we've got really not great performance, right? We're spending a bunch, and the outcomes are, and the sort of system performance isn't very good. And we all know that in this room, and that's kind of one of the reasons we're here. But I think this is a fundamental problem that needs to be solved, and as a core part of why we started Hint Health. So it's not all darkness though, right? This is one of my favorite quotes. When it's darkest, you see the stars. This is attributed to Emerson, as also King, and a bunch of other people have said it. But I believe that the way to change things, right, is to be positive and to try to figure out what is it that we can do, what are the changes that we can make now that can transform things in the medium to long term. And so the question becomes, as it relates to healthcare, is what are the problems, right? It's not possible to fix something that is so broken without understanding the problems. And the way I tend to think about the issues is that the reason we have a broken system is because of the lack of price transparency, the perverse incentives, as well as the high administrative overhead that's attributed to the insurance fee-for-service infrastructure, and the fact that the majority of healthcare spend is running through an antiquated system. It's running through an antiquated chassis that's got itself into a position where no actor can break from the arms race, essentially. And this has been famously quoted by Buffett as the tapeworm of the American economic competitiveness. It's part of the reason the US is kind of struggling across a few areas. So the question then becomes, what is it that we're going to do to fix that problem? And so the other thing I'll just mention is that it's not as though there hasn't been any innovation in healthcare, right? There's been a ton of innovation. There's been billions, hundreds of billions of dollars gone on over the last decade, 2 decades, to trying to address problems in healthcare. And the thing that I think is really important to understand is it's not working. On the margin, yes, the innovation we've seen is making some impact. But at the end of the day, we're still seeing 47% increase in insurance premiums for families over the last decade, which far outstrips workers' earnings, and it far outstrips overall inflation. And so, from my perspective, we need to start thinking about how can we transform the system at a fundamental level. One of my favorite quotes is, "You never change things by fighting against the existing reality. To change something, you need to build a new model that makes the old model obsolete." And I think this is the way I tend to think about transformation in the US healthcare system. So our vision at Hint is to redesign the healthcare system to enable easy access to high quality, affordable care. Now remember, this is a long range vision. This is a decade vision, a decade plus vision. But that's the way we tend to, at Hint, think about transformation at a large scale, long term. So then the question becomes, what is it that we're going to do to help start moving in that direction? And in order to kind of share the way I tend to think about the solution to that, I wanted to take you on a little bit of my personal journey. So I grew up in New Zealand, and for those of you who don't know, New Zealand's not in Europe, and also it's not part of Australia, it's next to Australia. But I grew up in New Zealand and on a farm, and this is some pictures of me and my family. This is actually me as a little boy there on the left, riding my stallion with my sister next to me. This is a family photo of me and my family on the farm. This is actually me growing up. I'm convinced this horse knew exactly what I said, because whenever I'd say bolt, he would. And so this was kind of the lifestyle I grew up with. And then actually during COVID, I went back to New Zealand to escape, because there was basically no COVID there, and kind of tried to continue sharing some of this life experience with my kids. So this is me with the goat on me, which is pretty cool, I thought. And this is a picture of my wife. And just to be clear, my wife's the one in the middle. But this is our horse. Our horse is Oti and Cookie back in New Zealand. And this is us, me trying to kind of make sure my kids got to ride animals as well. So this is my daughter, Mila, riding a sheep. I think it's pretty funny. And my daughter, Charlotte, that's riding our pony. So anyway, the reason I share that story is one of my vivid memories from growing up in New Zealand, excuse me, was our family doctor, right? I have this vivid, New Zealand isn't without faults as it relates to the healthcare system, but I have those vivid memories of having a doctor, Dr. Dave Summerton, who knew my name. If I was sick, my parents would call him. So the early days of telemedicine, right? Just making a phone call to your doctor. He was actually part of our community. He would come to our, the occasional party we had. If we were sick on the weekend, no problem, he'd figure it out. I even remember him showing up to the hospital when I was sick. So this was a kind of profound experience that I remember as a child. And when I came to the US, it was this jarring experience of sort of almost the exact opposite of that, right? This sort of very complex system, very hard to get care, ultimately with a system that is driving the providers into the ground, and the inability to really kind of get good high quality access with real human connection to a doctor. And then that's when I kind of eventually, through my journey, which I won't go through every detail of it, we eventually came across the direct primary care movement, which was a kind of as close a thing to that family doctor I had as a child as I had experienced since that time, and a much more simple, much more aligned relationship where the provider would actually get to know you and be incentivized, not have all the perverse incentives such that they're seeing so many patients per day and all the things that we've heard about at this conference. So the other thing I thought was really interesting is when you peel the layers back on this innovation and this kind of new way of doing primary care, it addressed many of the fundamental problems that we saw as it relates to the insurance fee-for-service infrastructure, right? This was not necessarily designed this way per se, but it had price transparency. There was nice natural incentive alignment built into the model, and it had very low almost no administrative overhead. So it addressed many of the fundamental problems, and importantly, although it wasn't at scale, and you could argue today it still isn't at scale, importantly, it was working, right? It was something that was working, and it was starting to scale. We're also seeing that employers were starting to say, maybe this is a way we can start to reform our healthcare model. And we started to see kind of the sort of lots of different sparks of innovation forming. And that's when my co-founder and I thought, let's build a company dedicated to supporting this movement. Now, when I was, and one point I wanted to make just around the evolution of movements and technology is, generally speaking, as humans, we're not very well equipped to estimate things. So generally speaking, we overestimate the impact of technology, or I like to think actually innovation. We overestimate the impact it can have in the short term, but we underestimate the impact it can have in the long term. The way I tend to think about direct primary care is that direct primary care falls into this bucket, right? It may feel slow, the growth, although it actually is pretty fast, but it may feel to this audience slow. But I actually think we're starting to come into this inflection point where we'll start racing up the S-curve, where the impact of this movement can start to be felt at much larger scales. And so this is sort of a framework I think is very powerful when thinking about the opportunity that we're faced with here. So then the question becomes, okay, well, how do you transform the entire system? And the way I tend to think about this is what we need to do is we need to, over time, carve more and more out of the kind of antiquated insurance fee-for-service models and bringing them into a direct care type model that is with a direct primary care relationship at the heart of that healthcare system. So essentially what we do is we have an ecosystem of transparently priced direct pay relationships that are grounded in a foundation of a of a direct primary care relationship. And I think this is the way I tend to think about the long-term vision for this, that this community is going to be helping push forward. And the reason that this community can help push this forward is because primary care doctors control the referral pathways, right? And you're more powerful than you think you are. You have more power in the system than you think you have. And that's the reason the big health systems are always trying to buy up all the primary care doctors, is because that's the control point. That's the place that all the true influence happens in healthcare. But you need to be brave and you need to fight the system in order to make it happen at scale, long term. So this is a point in my time when I was developing my talk today, I got a little bit stuck. This is how I tend to start. This is what my presentation looked like a few weeks ago, or maybe more like a week ago. I'm a little bit of a last-minute guy. Stop laughing, Greg. But I was having a conversation with Daniel, who obviously I'd invited to come and share kind of his views at the conference yesterday. And I spent a lot of time with him talking about the direct primary care movement and getting his perspective on the way we tend to think about it. And he, after I had a conversation with him one night, he's actually nocturnal, so he stays up late, and so I had a conversation, went to sleep, and the next morning he had left me a voice message, and I just thought it was quite profound. So I planned to read pretty much word for word the message that he'd left me, because I think it was very powerful. So regarding your talk on the light and the darkness, you suggested connecting that to the systems idea, where you can't just fix one thing, but you also need to fix these other things, as they are all interconnected, and you really can't just fix any of them if you don't fix them all. That sounds like the minimum project is a lot. It is a systemic, fundamental redesign. And the idea that you don't need a floodlight, that you need just one simple candle, it seems like the opposite kind of sense. And just to provide a bit of context on that, what I'd said to him is, the way I tend to think about it is when it's dark, you don't need a floodlight to light up the room, to show the way. You just need a candle. And so he went on to say, those two messages can seem incongruous. Of course, there's a way to relate them, but you have to do the work to relate them. Healthcare is a complex system, and there are many aspects that have to change in terms of how we do diagnostics and interpretation, fundamental medical research, medical paradigms, funding paradigms of insurance, pharmaceuticals, hospitals, regulation, food systems, etc. While all of that is true, what is foundational to medicine and what could move the whole spirit of the thing in the right direction is the doctor-patient relationship, being a sacred relationship that is supporting the life and aliveness of the human being, and someone having a profession whose life is dedicated to being in that sacred contract with other people, opposed to the insurance model and the hospital administration models that have intermediated things to the point where patients don't really have the depth of relationship with their doctor any longer, where their doctor is no longer making their choices with them. Instead, patients have a relationship with an insurance plan that will shunt them to different doctors, limit what the doctors can do, and they have a relationship with a market of expensive for-profit options where they have to weigh their possible health issues against their ability to support their life and family. Having those considerations at the center is very different from having a sacred relationship of healing at the center. Who is choosing and interpreting diagnostics? Who is overseeing the medications? Who is working with the patient to make consequential decisions about their life that involve real uncertainty? Ideally, that should happen largely in the context of an enduring and deep primary care relationship. And the fact that all these doctors and innovators, the ones that have already joined Hint and this community, and who on their own have gone to a direct primary care model, and who all seem to have in common a desire gosh, I always say I won't get emotional, but I always do. So, all right, here we go. And who all seem to have in common a desire to move the money, insurance, administrative and legal arrangements out of the centre, tend to them in a different way. I might have to get someone else to come finish this for me. And move the relationship of the doctor and the patient and the sacred contract between them back into the centre. That is profound. This is actually the important part, so I don't want to miss this part. Now, if that becomes a centre, that centre will be able to move everything else. All of the other aspects of medicine, which ultimately have to work through the centre. And so the integrity of that centre is fundamental. If you feel that this community of people are committed to this, I'm going to need your help to get through this. Yeah, if you feel that this community of people are committed to this, even in the presence of the formidable pressures, financial, regulatory, status, and everything else that is pushing in the other direction, because they I cried at my wedding as well, for what it's worth. Because they are actually committed most deeply to their sacred oath and the experience of their patients, then they are the light. They are the candle in the darkness that has the ability to fundamentally move the entire complex web of things. So that was it. so yeah. So. We love you too. All right, so I found that to be profound. And so I wanted to invite you now to share a kind of experience with me. So what I would like you to do is get your phones out. When you see me turn my light on, please turn your light on and shine it at me. And enjoy what we've got here for you.
It wasn't always the way it is today. There was a time when the patient came first. A time when someone's health was not overshadowed by bureaucracy. A time when care was care. But with time, in came the greed, in came the power, in came the darkness, suppressing the light of care. Health was now a business, placing profits above all else, and the light of care went out. But you can't hide the light forever. One by one, tenacious leaders arose, and a community was formed. A community committed to doing things differently. A community focused on transforming a broken industry. A community dedicated to restoring the spirit of medicine and putting the light of care back into health. Little by little, this light began to spread from practice to practice, from one entrepreneur to another, working together to inspire, to connect, to activate. You are the light.
So I thought it was great. Thanks to the team that put that together. I love that video. So I wanted now to move on to just some updates on Hint and where we're heading. And many of you in this room have seen kind of this graph I've built, or some of my team have built. And I just wanted to share this again because it's relevant to one of the announcements we have. So this is what you call a force-directed graph. This is each of these is one of our customers. This is Dr. Rob from day one, all the way through to every single customer that's joined the Hint ecosystem. And you can see the blue dots are, let's say, Hint account. The light blue dots are multi-location. The red dots are employers. So you can start to see some of these dots are actually, groups that are starting to work with employers. And you can see that kind of evolution going through time. And what's really interesting is you'll start to see kind of networks forming, right? This is sort of the emergent property of this ecosystem, sort of naturally moving towards collaborating with other doctors and primary care groups, forming networks so that they can serve larger and larger employers and kind of in a way that's collaborative. And if you zoom in on this, what you'll actually see is a tremendous amount of connectivity happening organically within the ecosystem. I personally find this to be very powerful because it's not a top-down kind of design modality, it's a bottoms-up emergent property of a system. So if we go all the way back in time and just you'll watch that kind of coming through time, and I just think it's quite a powerful visual to see that happening over a period of close to 10 years. And I'll just leave you sit with that for a second. Pretty cool, right? So, the part of the reason I wanted to share this is because we recently developed a research report. You can download it here. You heard some of this yesterday with Amy talking through kind of the trends in direct primary care. Just for note, this report's had hundreds of hours of work has gone into it. There's thousands of DPC providers, hundreds of thousands of members, millions of data points. And also, interestingly, we did an independent consumer research report as well with 1,000 or so consumers to bring data in to help kind of fill out the report. So we're really proud of this work, and we'll continue to be doing work like this to try to kind of share kind of insights with the community. One of the pieces I wanted to pull out of the report was this data point, which is really interesting as it shows that clinics that belong to an affiliate network of at least one affiliate network are growing around about 2x the rate of unaffiliated clinics. And one of the things that we're really trying to help with at Hint is to help further growth of the community. What are the things we can be doing to help grow the movement? And so this is really interesting data for us because it shows that there's clearly some signal here suggesting that clinics that are collaborative like that will grow a little bit faster or a lot faster. And so that is part of the kind of inspiration behind us launching our what we're calling Hint Connect, which is really a collaboration with both the independent providers that we're working with at Hint, as well as the networks that have been organically forming, as we saw, to try to help bring more lives through larger and larger employer contracts into and as a way to collaborate with innovative kind of neo carriers or challenger carriers like the Decents and the Flumes and the Poppins of the world. A way to make it very easy for them to plug into the DPC ecosystem, but on the terms of the DPC providers. And so to kind of talk more about this, I wanted to bring Dr. David Cameron, who's the Chief Medical Officer of Hint Connect, which is actually an independent entity, as well as Beth Holmes, who's our Head of Network Development at Hint. So welcome to the stage, David, Cameron, and Beth Holmes. Yeah. So Beth, thank you for being here with me. I'd love to just hear from you the sort of genesis of Hint Connect. What is it that inspired us to create Hint Connect?
So as you know, our mission at Hint is to make direct care the standard of care. And there are half of Americans who get their healthcare through their employer, they're not getting DPC. Right now, we have 250,000 lives that are employer-sponsored running through DPCs. That is amazing. You all have done such good work getting employer-sponsored members to get your amazing care. But that's not half of America. And as we've been talking to employers, what we've been hearing is we need a bigger swath of DPCs. We need it to be easier. We can't hold 25 separate independent contracts. We can't even hold one. There's no one in HR who knows how to do that. So, DPC networks have grown. We've talked to DPC networks, and we want to partner with DPC networks and independent DPCs who want to stay independent to bring their services to larger employers. And that's what Hint Connect's mission is to do.
Right, and so you mentioned DPC networks. How does Hint Connect interact with those existing DPC networks?
We want to partner with them. So we think they bring a lot of value. They have the relationships in their local markets. They have trust. They know how to work with employers. And so a lot of them are here today, and we want to learn from them and partner with them as they lead the employer-sponsored coverage in their area and plug them into Hint Connect so that we're stronger with them.
Great, awesome. And so Dave, what is it that inspired you to join Hint Connect, and what do you see kind of the opportunity?
Yeah, I love direct primary care. I've been in direct primary care for the last 10 years. Never going back. Never going back. I remember people asked me, 12, 15 years ago, would I recommend going into medicine? And honestly, I'd say no. But now my kids are starting to see that I like going to work, that I enjoy my job, that I have enjoyment and it's professionally rewarding. And someone actually asked my son, who's never said this before, they say, hey, what are you going to do when you grow up? He's 16. And he goes, I'm thinking about being a doctor. I was like, really? and you know what? I want the healthcare environment to be a blessing to him if he decides to go into healthcare. I want him to become a direct primary care doctor, and I want it to be a place where, so I think the two hardest things about direct primary care, why it's so scary to be a direct primary care doctor, is one, you have to run a practice, you have to build a practice, run a practice, and you have to fill it up from 0 patients, and it costs a lot of money, and it's scary financially. But if Hint Connect can help to bring volume of patients to all of our practices so that we can be successful for my kids who might be a direct primary care practice one day, to me, I would find that just so professionally rewarding.
That's great. And so, I love that your son's thinking about going in, because I think most of the doctors I spoke to, prior to DPC, would have actually not recommended their children go into medicine. It's pretty not great, right? Because often it's you're following in the steps of the people you love and respect most, which is your parents, right? And so just love to get your thoughts. Maybe start with you, Beth. Traditional insurance networks haven't kind of traditionally been great for independent providers, right? And so how are we going to make sure that DPCs are treated well and that we don't fall into that same trap at Hint Connect?
Yeah, so hopefully no one's holding any rotten tomatoes, but I used to work in health insurance contracting. And what we would do for independent providers is have the people who just started at the health plan send them our contract and say, take it or leave it. And these people, they weren't even, didn't know anything about healthcare, public health. And they would say, you can take these really, really low rates or leave them, but if you won't, we don't even care that you're in our network. We don't know what services you're providing. We don't know if it's good or bad. We're gonna spend 99% of our time on the really big systems because that's where the money is. They're the ones with negotiating power. And so it wasn't just that health insurance networks weren't designed with independent docs in mind. It's they're intentionally excluding them. They're intentionally saying, you don't have the power, so we're not going to talk to you. So what Hint Connect, where we're starting from, is a place of power for DPCs. And there's no one else in the room. There's no specialist that you have to share your rates with. There's no hospital. This is a network I'm sorry, I have to use that word, for DPCs, for them to remain independent, for them to receive lives through larger employer deals that they wouldn't otherwise be able to access, and to just feel like the lives coming in through Hint Connect are like the lives coming in their community, because they are people in their community just who have employer-sponsored coverage.
Right.
And I must say that it's really nice to be in meetings with Beth because she speaks their language when we're talking to TPAs and brokers. I mean, I speak a doctor language, which I think gives two different sides of authenticity to the conversation. But it's really nice having Beth being in that industry because she can speak the language and she knows what they want and can be able to speak to that.
That's great. And so maybe on that point, could we talk a little bit about why a plan sponsor or TPA would want to work with Hint Connect?
Yeah, so if you think about all of the employers who offer their employees health coverage, they're not experts in healthcare, but 60% have decided they want to go self-insured because they think they can do it better than plans. Whether they know it or not, they have already lost trust in the system. So they're already on our side, right? So what we need to do is find those partners. You mentioned some of the innovative TPAs who we'll talk to later, to help facilitate bringing in the message about direct primary care and about the patient-doctor relationship. Because we can say, so this is a subscription model. What does that mean? Is that concierge? This is a growing movement. These are PCPs. Well, that doesn't mean anything. It's telling the stories. It's featuring the faces of the providers and the patient stories, and partnering with these organizations who are helping give access to employers and employers who really want to do a better thing. Yep. Partly for employee retention, a lot for cost savings, but also because, do you feel a responsibility to us as your employees?
I do.
Yeah, I think most CEOs and entrepreneurs do. Small businesses, large businesses. Yeah. You don't want an unhealthy workforce. You don't want people not being able to access care, but people's arms are twisted. Those are the options that they're getting. Consumer-centered health plans that are not consumer-centered at all. And so why would they choose Hint Connect? Because we're putting primary care back in the center. And like you said before, early in your speech, that's where the power of the health plan is. So it's not just managing referrals. It's PCPs working with trusted providers in their community whom they know. It's PCPs taking the time to do kind of the extension of their services, not just referring because they get a bonus on referring from the system that they work in. So lifting the hood up is what we can do, and really making DPC shine and letting more employers know about them.
Yeah, that's great. Would you add anything to that?
I just
think nail it?
From the doc, I'm going to take a little different slant in terms of what I want as a doctor in this. And I think one of the things that I really want in a relationship with Hint Connect as both a DPC doctor is I want autonomy. I want to make sure that no one's going to tell me how to practice medicine. I don't have to be checking all these boxes. And one of the things I really like about Hint Connect is, as we've been forming this, is that the DPC practices will set your own rates. And it's non-exclusive, so you can join multiple other networks. And I feel like that's the way that we're going to be able to have the proverbial floating all, the rising tide can float all boats.
Yeah, that's great.
And if I can add to what Dr. Cameron said, we have a little bit of a backdoor into your panel numbers because most of you are managing your panels through Hint. And we see you need help with growth. The DPC is growing, but if it's a leaky bucket with retail. Growth in the first 3 years can be slow. I've heard a lot of docs this conference say, like Dr. Brooks said yesterday, 8 months in, her clinic's paying for itself, but not for her. We want her to make a salary, right? We want you all to be able to, support your families and live the lives you want to live. And so helping fill those panels is a dual goal.
All right, great. So if people are interested, how can they sign up? How do they engage with Hint Connect? What's the next step there?
Well, Dr. Cameron, myself, and Ji Shao on my team are all here. You can talk to us. You can go to www.hint.com/connect. You can write into networkdev@hint.com, or just, you know how to get in touch with Hint. Customer service can find us too. So get in touch with us. Well,
if you ever need anything
you.
from Hint, our customer service team is right there for you. So, all right, thank you so much for being here.
Zach.
Yeah.
You blacked out.
All right. So next up, I had an announcement to make. We recently closed the financing round. Many of you have all seen this already. And one of the things I just wanted to quickly talk about was how when you are such a mission-driven company that really truly has long-term vision around transforming something for the better, it's really important to make sure you align yourselves with the right investors who share your vision at a fundamental level, because the last thing you want is to have kind of disagreements at that level. And so I'm really proud of the team we've pulled together, Banneker Partners and FCV Ventures. We're really excited to be partnering with them, and they're actually here with us today. So if you kind of go find them, they're great people, and we're really excited to partner. And I think really importantly, they're investing in our team and our vision, right? They're investing to enable us to continue accelerating our vision. And the way I tend to think about it is that in order to transform the healthcare system, we need to figure out how to get DPC into the hands of hundreds of millions of people. And I'm of the belief that potentially we could do this organically without capital, but it will take a long time. And my goal with this funding is to accelerate that adoption and do everything it is that we can do to help push the movement forward as quickly as possible, while making sure that we don't threaten the integrity of the direct primary care movement. And so really excited to kind of announce this. We have a bunch of plans that we've got coming up here, and I wanted to just sort of invite my co-founder, Graham Melcher, who's our CTO, and our head of product, Alexa Schulte, up to the stage with me just to talk about some of our plans and vision for where we're heading with some of in the sort of short to medium term. So welcome to the stage, Graham and Alexa. So we just closed this big round, Alexa. Really excited about it. What are we thinking? You're the product lead. How are we going to spend the money?
That's the $45 million question of the day, huh?
Yeah, totally.
So rather than directly answering you, I'd rather talk a little bit about how we and the team think about the work that we're going to do and how we really deliver for the folks in the audience. So first and foremost, we're going to be doubling down on delivering value to our core DPCs. So what that really means is finding the biggest opportunities that we can to, reduce that operational burden and ease the overhead that, everybody's experiencing when they're trying to grow their practice. So we take the team, we get on site with our clients. We were just down with Frontier that you heard from yesterday down in Texas. We have Canny, our feature request tool, actually hooked up to our Slack channel. So we see real time every request that comes through, the thumbs up, the downs, the comments. We see it. It's a direct line. Use it. We dig into all of our wealth of data that we have, not only on the app, but the DPC Trends Report, as well as all of the relationships we have with our customer success and sales teams to figure out, what does that look like and make sure we really understand what our clients are looking for.
Alexa's really great at avoiding my direct questions about what we're going to do next.
It's my job.
Yeah, totally. So I see this team as the sort of layer between me and all my crazy ideas and actually getting stuff done. So,
yeah.
So
my
maybe
job from the beginning is really just to tell Zach no.
Yeah, totally. But I sometimes get some stuff I want. But anyway, so Alexa, maybe can you sort of give us something, like what's at least one thing we might do?
There's a couple things that, we have coming up. So there's a story first, just to set the stage for some of, the work that we're going to be continuing on in the back half of the year that I want to talk about. So over the last 6 months, we've really been focused on saving people time, particularly as it comes to managing all of the benefits and perks that are included in your membership. So we've built out, ways to have a rules engine and all of these screens and, features, and we can throw up screenshots. But I'd rather talk about how one of our clients, primary health partners, you heard from Drs. Rickner and Lockwood this morning, how they've been able to leverage it to actually, increase their membership and their benefits. So one of their largest employers, Life Church, approached them and said, hey, awesome DPC membership, employees love it, but we want to add a little bit more to it. We want to throw in some lab tests, some allergy testing. And PHP sat down and was like, it's kind of a lot. Just for reference, several thousand patients, many locations, and approaching 100 employer relationships. So what this means is they'd need to go to every location and say, hey, some patients, sometimes for some lab tests and some allergy tests, make sure it's $0. Document it, put it in as a charge, but they're not going to pay for it. But everybody else, make sure you keep doing everything that you're doing. So what's that? It's spreadsheets, it's binders of rules, it's sticky notes and emails, and completely not operationalized. You can't scale that way. Fast forward 6 months, the team's been behind the scenes building out these rules capabilities and this engine, and PHP got set up on it and was able to actually go back to Life Church and say, yeah, let's do it. Let's add these tests in, because Hint's going to take care of that kind of operational overhead in the background.
Yeah, that's awesome.
So, as much as we love to sit up here and kind of talk about features, what the team's really looking for is that, we're putting things out there in technology that are enabling them to deliver a more compelling DPC membership.
Yeah, and so I guess some of the next things we'd think about as it relates to that, and some of the partners we work to, maybe address that for a minute. Then I'm going to ask you a question.
So kind of continuing to iterate from there and just adding more automation behind the scenes. So we've broken ground with our partners Acute and MD Scripts, so that when you're actually going in and prescribing, we'll automatically push that charge into Hint, we'll run it through our rules engine, we'll drop it on the right invoice so that you're not going, all right, prescribe here, turn around at the end of the day, enter all your charges in, pick up that binder of rules and make sure that you don't forget anything. We'll actually do all of that behind the scenes via API. So we're starting with, go ahead, Graham.
No, I was going to say that the rules engine also will know, is this a charge that should be going to the employer and what cost, or
That's
going
right.
to the is it out-of-pocket cost for the patient, and then what cost, based on their plan that they're on. So it really adds a ton of power into the way to manage that.
Yeah, and keep that mic nice and close. Yeah. Okay, that's great. And so, some of our other partners looking at that as well? What was the...
Yep, so we started with Acute and MD Scripts, but later in the year we'll be pushing that, not just with medications, but expanding it across kind of all of your ancillary orders and working with Elation, Athena, Serbo to make sure that we have you covered across the spectrum in the ecosystem.
Great. Yeah, and so Alexa's not going to give us, she's not going to let me talk too much about other plans, but those are some great ones. So Graham, love to hear your thoughts. We serve both small independent clinics and then some of the very largest, DPCs in the nation. How do you tend to sort of think about scale and, maintaining, ensuring we continue to deliver value while also making sure we can continue to scale? How do we do all that?
Sure, this is the more my side of the house. It's a delicate dance between wanting to free the team to push out features, create as much value as we can for our customers, while ensuring that the security, performance, we're managing our technical debt is what we call. You have to update the software on your computer every once in a while. We have to do the same thing and stay on top of security patches, et cetera. And Zach and I started Hint almost 9 years ago, and at the time, the technology we chose was state of the art. Technology moves pretty quickly, and it's not anymore. So one of the big investments we've been making over the last year and a half is actually rebuilding the entire front end from the ground up. And you probably haven't noticed, even though you're actually using, we're about 80% complete, so 80% of the app is now migrated over from AngularJS, which, again, is pretty old and was starting to kind of show its age. We were releasing more bugs than we would want to. They were harder to catch, and the pace of development was slower, and our engineers, frankly, just kind of hate it. So it was time to move on. We're moving to a technology called Elm, which really is cutting edge. It's functional and strongly typed, which probably doesn't mean a lot, but it's will enable just sort of a rock solid foundation for the front end and allow us to really in a way we really couldn't before, innovate on some of the user experience and allow us to really redesign some of the way the app works to support some of the initiatives that we have coming up later this year. So very, very excited about that. We were starting to transition our focus onto performance, and we have a lot of exciting things around database scaling and just general scaling of the application, which I'm not going to bore you all with, but I'm happy to talk about if anyone wants to.
It's pretty cool. Yeah.
Yeah, it is very exciting, but also very nerdy.
And so, Graham, does that mean that we can sometime in the near future, and this is my way of getting maybe an answer, is this sometime in the near future, like redesigning the app that me and you, like making it look cool? That me and you made about 9 years ago. That
those of
look
you,
very cool.
Dr. Rob and many of our early customers will have noticed that the homepage hasn't really changed.
Vintage has its time and place, but maybe not in HintOS anymore.
Yeah, so that's an initiative that we're pretty excited about taking on later this year.
So it's almost like we're flying a jet along, hundreds of thousands of lives, hundreds of millions of dollars going through the platform, and you've been sort of replacing the jet engines, but not the actual shell of the plane. So once the jet engines are replaced, then we can kind of make the shell look pretty, basically, easily.
Yeah, and it's someone on our team, Adrian, a little shout out, really created a really unique and kind of awesome technology that we're using to rebuild page by page the application. And so we're releasing a few new pages every week. And it's really seamless and transparent, and we're not stopping all of development for months and months while we rebuild everything. We're just doing it on the fly. And that's part of our continuous delivery sort of methodology, where we're doing several releases every single day and really rebuilding the plane as we're flying it.
Yeah, and so when he says several releases every single day, what he means is we're actually pushing code to production live every day multiple times. So you're going to be using Hint, and in the background, the system's just updating, multiple times every day, which is actually pretty powerful to be able to do that, because it allows you to move really, really quickly and not introduce problems and bugs as you do it. So maybe just to sort of wrap things up here, sort of a lob question to both of you. Any sort of interesting things that we're thinking about on the sort of medium to long-term horizon from our kind of a product innovation perspective that we can kind of talk about a little bit?
Yeah, so I know Graham kind of teased new UI, so we'll give you that one. But on the longer time horizon, really thinking about kind of the value of DPC. We heard it yesterday, we heard it today. Swear we didn't pay Clint to queue up that challenge for tackling this problem. But we all inherently understand the value of a DPC membership. We see the health outcomes, we see the cost savings, but thinking about what we heard yesterday with the arm break, in the audience, we're like, what is that, 10K, 20K? I think we landed on $2 infinity is what that family saved. You can kind of make these off-the-cuff guesses, but being able to actually quantify in the way for those pesky employers that are in the background that are like, we want the piece of paper, just give me that number. Once I have the number, that's comfortable for me, I want to move on. That's a space we're really starting to dig in and explore. So, not just for our DPCs, but also for Hint Connect that's having, the same questions and kind of value prop to figure out products and solutions there that will help us move that without getting in the way of, delivering care to your patients.
Yeah, so the real design challenge there is how do we get data that is useful to kind of help substantiate value, but in a way that doesn't interfere with the doctor-patient relationship, right? Like
Exactly.
That's the design challenge. Right. And it's not an easy challenge, but I think it is possible.
And with Hint Connect, we're going to have doctors using different EMRs, different systems, different technology stacks. And so how do we pull that, kind of unify it and turn it into something that an employer can look at and say, oh yeah, I can see that impact. And that's also looking, claims analysis. It's we know sort of the landscape of what's involved there, but with Hint Connect, we have an opportunity to actually do some of that ourselves.
Yeah, so it's great. Hey, well, so thank you so much for sitting up with me with here, and just a round of applause for Graham.
Thanks.
Thank you.
So I just wanted to close today just to reinforce this idea. Our vision at Hint is to redesign the healthcare system to enable easy access to high-quality, affordable care. We see ourselves as partners with this community, right? So always keep challenging us, always keep pushing us. We're here for you. And never forget it, you are the light.